viewers at home and around the world. We're happy to be back this morning on your regular Saturday morning health talk show, Health Matta. And with me today in the studio is an associate professor from Luth. She is Dr. Bolanle Akinbobye. She's an associate professor of prosthodontics in the Department of Restorative Dentistry, Faculty of Dental Sciences, College of Medicine, University of Lagos, and also a consultant in Luth. Today she'll be talking to us about tooth loss. Tomorrow is World Oral Health Day. So we'll be looking at tooth loss, causes, and of course, treatment options. Okay? I'm sure a good number of us know that with advancement in age, we sometimes, as adults, our teeth begins to get loose along the line, oftentimes falling off. Some adults may have none at all. Okay, so today we have an opportunity of listening to an expert who will tell us the causes, what we need to do to guide against this. A whole lot of things can actually lead to tooth loss in human beings. One of them is gum disease, okay? Injuries too can play a role, okay? So I'd like to yield the floor to her to tell us what we need to know about tooth loss, causes, complications, and of course, treatment, ma. Thank you very much.
Good morning, viewers. Good morning. This morning I'll be talking about tooth loss. The teeth, where do we find the teeth? We find it in the mouth. For the younger age, you find the tooth, we call the tooth the deciduous teeth or the baby teeth, and there are 20 in number. But after that, you have those baby teeth coming off and giving rise to the adult teeth, which is 32 in number, ideally. But sometimes you find out that you lose the tooth. This can be caused by various factors. The causes of tooth loss can either be maybe tooth decay. When you have tooth decay, the tooth might be lost due to that. It might be due to gum issues. That could also lead to tooth loss. And when we talk about tooth loss can either be partial tooth loss or complete tooth loss. When you say partial tooth loss, that means you still have some teeth remaining in the mouth. But sometimes you have complete tooth loss. And tooth loss usually is due to cumulative effect of oral diseases. I've mentioned some of the oral diseases. I've mentioned tooth decay, which we call dental caries. If it's not well taken care of, that could lead to the loss of a tooth. Sometimes it could be as a result of the gum diseases, which we call periodontal diseases. That could also lead to tooth loss if not attended to early enough. Sometimes it can be due to trauma as a result of impact, accident, fight, that could cause loss of teeth. Sometimes you have it being developmental, that you have people not growing teeth at all or having few coming out from the mouth. Sometimes you could have syndromes such as ectodermal dysplasia. This could also result in you not having the teeth. And we all know that the teeth is very important in the mouth. It serves functions for chewing, speaking, smiling, aesthetic, looking good, and it also has a psychological effect of helping to give emotional, when you give emotional support, psychological support. When you have a good dentition, you can relate well with people. But when it's lost, it also has its negative psychological impact on the person or whoever has tooth loss. And apart from that, when there's complete tooth loss, it also affects nutrition because it actually determines the kind of food you can eat or chew on. The healthy food, like all the ruggages, will be impaired. That means you won't be able to eat such food. And that could affect the intake, the nutrient intake it can also complicate existing systemic diseases. For example, someone that has hypertension, diabetes mellitus, and when you've had complete tooth loss, that means that you are only restricted to soft diet, and these soft diets can be in form of refined food, and refined food, it's not so healthy. That could actually lead to the complication of existing systemic diseases. So it is important for us to actually make sure or ensure that we retain our tooth in the mouth, and make sure that we visit our dentist often so that we can prevent tooth loss.
Thank you very much, ma. What are the risk factors for tooth loss?
Okay.
Are there risk factors for that?
Yes, there are
Okay.
some risk factors. But first, I want to start with attitudinal factors.
Okay.
When an individual does not have a right attitude to keeping good oral health, then that's the high risk of having tooth loss. Now, apart from that, there are some systemic diseases such as diabetes mellitus. Now, when you have diabetes mellitus, what it does is there's a reduced effect of defense system. Now, when there's a reduced effect of defense system, what happens is that normally what you will resist, it will be slowed down, and that will increase the tendency of you having gum diseases. And sometimes when you have poor oral health, when you don't do justice to teeth cleaning, that could also lead to accumulation of what we call plaque, dental plaque. They are whitish, soft, tenacious substance that they naturally are deposited on the teeth and around the gum. And when this is left and it accumulates, it can lead to periodontal disease, tooth loss. It can also cause caries. Now, in some individuals, they have a habit of snacking on sugary things, refined carbohydrates. The word is snacking. That means in between meals, you're always taking in sweet things. That could increase the risk of developing tooth decay, and that could lead to tooth loss. Now, once we have, I mentioned partial tooth loss initially. Now, when you have partial tooth loss and this is not replaced, it could also increase the risk of losing or further tooth loss. Because what happens is that God has made it in such a way that all our teeth, they complement each other and help to put the teeth in their right position. So when one is lost, the one in front or the one at the back moves to that space. The opposing teeth also moves down in such a way that you now have gaps in between the teeth, and this also increases the risk of food packing in between the teeth and increases the risk of tooth decay and tooth loss. So it's like a ripple effect that keeps going on.
Thank you very much. Diabetes also reduces the blood supply to the teeth.
The teeth, yes.
Okay, so that can also lead to the problem as well. Okay, so we are still on the risk factors. What is the place of smoking?
Yes. So smoking also is also a risk factor.
Okay.
And obesity too.
Yeah. Why is it that males are said to lose their teeth more than the women? What is responsible for that?
I will say,
and at what age?
It's still an attitudinal problem.
Okay.
Because females, it's believed that females, they take more, they are more conscious of their health and their looks more than the males.
Or they snack more.
Yes, we do.
Okay, go ahead, ma.
Yes, and it is also important that we keep drinking water, because that helps to wash away the oral environment and keep it clean. And then, must not forget that every year, twice a year, you should actually visit your dentist for scaling and polishing. And then in between, flossing, dental flossing is very important. So when we have this tooth loss, what are the treatment options that could be done? Now, it spans from either you do what we call removable. It can be removable or the fixed one. When you talk about removable treatment option, you talk about the dentures. The dentures also have their different materials. We have ones we call acrylic dentures, the metallic dentures, and then when we talk about the fixed one, we talk about the bridge, and we have the dental implant. Now, all these treatment options have their side effect, the good, the advantages, and the disadvantage. So depending on the ones you want, and you know that for any treatment option that you have, there should be maintenance. That means that you need to keep going to your dentist for proper examination.
Thank you very much. Now, in the olden days, our forefathers, even up till now, we still see some elders that said they don't want to use toothpaste. They are okay with using chewing sticks.
Yes.
And all of that. Are they losing anything? Because these days we hear about fluoridated toothpaste and all whatnot. That seems to be the in thing. So anybody who does not use this fluoridated toothpaste, what is the person depriving himself or herself of?
There's nothing bad in chewing stick.
Okay.
You also have some chewing stick that has medicinal properties, have fluoride and all that in, depending on the type. But you know, when you use toothbrush and toothpaste, the toothbrush has bristle, and that bristle goes into the corners of the mouth, and you are able to do your mechanical cleaning efficiently. Now, for you to have that in the chewing stick is not so easy, because like you said, it's a stick and it's not in form. You have to really chew the ends so that the ends will be like a bristle, so that you can ensure that you have that mechanical cleaning around the teeth and interproximal in between the teeth. So that is not so convenient as regards using toothbrush and toothpaste, because fluoride also is very important in toothpaste. It helps to fight against tooth decay.
Thank you very much, ma. Now, are there things you need to tell us? Okay, the last time we had World Oral Health Day presentation,
yes,
we were told how to do the toothbrushing when we are at home. What is the best time for brushing of our teeth?
Okay.
Is it after we have had our breakfast? We've been tutored. We've been told that it has to be done at least twice in a day. Is it after we've had our, when is the best time? After we've had our breakfast or before breakfast? And when should be the last time?
Okay. So for everyone, we're supposed to brush twice a day. That's the last thing in the night and after breakfast. So the reason is that you don't want any food left in the mouth during that period of when you're sleeping and when you wake up in the morning. And when you wake up in the morning, you have your breakfast and then you brush, so that there's no food left in the mouth for bacteria to work on.
I'd like to open the phone lines at this stage so that viewers at home from all parts of the globe can make their contributions, can call in and ask their questions, should there be any. Okay? Thank you very much once again, Prof. I appreciate your good work. Now, I want to ask, are there things we should know about tooth decay or tooth loss and pregnancy? Is there any correlation between pregnancy and oral health challenges?
Yes.
Okay.
When you are pregnant, it's because of the condition. It's a physiological, not a pathological condition. There might be exaggerated reaction to the presence of dental plaque in the mouth and calculus, and this could cause gum bleeding. It could also cause what we call epulis gingiva, like gum swelling in the mouth. And if this is not adequately taken care of, that could also predispose to tooth loss in pregnant people. So it's advisable for them that during this period, there should be improved oral health, good oral health by treatment, scaling and polishing, coming for assessment and checkup in the dental clinic. Then one thing I also forgot to mention when we were talking about the treatment options that are available for tooth loss is sometimes you find out that due to surgery in patients that have tumors, cancers, and they've undergone surgery, that they have to remove maybe the tumor and associated teeth that are involved in the tumor. They also can come for what we call the replacement. The replacement, we usually call it for the upper jaw, the obturators. You have obturators for them, which helps to actually replace the lost tissue and the tooth loss and help to create a barrier between the nasal cavity, the nose, and the mouth, so that it helps to restore the chewing and their speech. For those that have the lower defects too, those also can have the mandibular prosthesis that can be used to replace and improve their appearance.
Thank you very much, ma. Some locally made substances that we consume in this environment oftentimes do change the colors of our teeth. I think kola nut does that, and a number of other substances like that. What advice do you have for people who consume such substances? That's number one. Number two, are they remedy? The color change of the teeth, can it be remedied? Thank you very much.
Yes. So we usually encourage our patients not to take such a substance, because what it does is it causes staining of the teeth. It causes extrinsic staining of the teeth. But there are remedies that could be done, because these stains can actually be removed. When they come to see their dentist, the stains can be taken off. They do scaling and polishing and then stain removal. And the smile can be restored back.
Thank you very much. Now, substance abuse. Individuals who abuse substance, it does have some degree of affectation to their teeth. You want to tell us one or two things about that?
This substance abuser depends on which one that you're taking, but most times, not only the teeth, but you have the oral mucosa too. After a while, it changes color. And then, depending on what nicotine and all that, you could also have a risk of developing tumors, cancers. And so because of that, we actually encourage people to stop taking. And then we have smoking cessation programs that could help, an habit cessation program. We have also in Youth there that could help them so that they can cease from such habits.
How often should one come for scaling and polishing? Is it root planning or what?
Yes, root planing.
Okay, planing.
Thank
you very much.
I mentioned earlier, for everyone, we should come twice a year for scaling and polishing, and for oral examination generally. But in some particular cases, especially those that you've talked about, that they take coffee, cigarette, they smoke, they should come more than twice a year because of the staining, and then so that could be taken off. And then you have some other people that have habits, parafunctional habits, like grinding. Those also can actually, they can be given habit breaker. We call them occlusal springs, and that could actually, or mouth guard, that could help to break such habits.
Okay. At what age does a man start losing his teeth? What age? I saw 35 years. I was wondering, shouldn't that be too early? It should be expected to be far when one has gotten to neighborhood of 60 to 65 years. But before that, let's take this call.
Okay.
Aki from Gombe. Good morning, sir. Good morning, sir. Are you there?
Hello?
Yeah, thank you. Turn down the volume of your TV set. Yeah, we've lost that call.
Yes. I smiled.
And also, you've not answered one of my questions. I will come back to it. Why is it that men lose their feet more than the females? Is there any particular reason for that? Okay, so
yes.
let's take the age.
Okay, so I smiled to that question because you are relating tooth loss to aging, which is the normal thing that the normal belief. But tooth loss is not related to aging.
Okay.
So you could have the complete, the complement, all the total amount of tooth. The 32 sets can be complete till whenever you decide to now take your visa out of the world to the great beyond.
Okay.
So it is not, it depends on you taking good care, having good oral hygiene. I know in some people, because of the tooth arch discrepancy, we say that for the last molars, some they have it impacted. We call it impacted because there's not enough space. So you find out that some don't have the complement of the 32 teeth because they have to do what we call surgical removal of the last molar. But in all, teeth retention can be there throughout lifetime.
Thank you very much for that clarification. Filling, when people present with cavities, how safe is that? Sometimes we hear, I've heard stories that some of the things that are used for fillings may not be too healthy, or it could be melted by some substance or some hot beverages and what have you. Is there any truth in any of these opinions?
So tooth filling, generally we do it as a treatment option for tooth decay. In years, the past years, we've been using what we call amalgam, which is actually silver in color. It's not the color of the tooth. But that is being phased out now because of some concerns in some quarters. So we have other tooth-colored material that we use now. We have the composite, we have what we call the glass ionomer cement. And I'll tell you, they are actually good. They are aesthetic enough. They just look at the color of the teeth. And they are durable. They are durable. And there has been improvement day in, day out. So, yes.
Yeah, let's take this caller. Mr. Yahaya from Niger. Good morning, sir.
Yeah, good morning, sir. The doctors in the house. Good morning, everyone.
Good morning.
Thank you very much. Nice to have
you.
Yes,
I want to ask a question on this issue. We've been advised medically that we can use this sodium peroxide. We use in the cleaning to brush our teeth regularly to kill.
Do you mean hydrogen peroxide?
Hydrogen peroxide. I'm sure it's hydrogen peroxide he's talking about.
Hydrogen peroxide.
Okay, thank you very much, sir.
Then secondly, the condition at which individual loses teeth at old age. What is the term we use in any such condition? Thank you.
Thank you very much. Prof will answer your questions.
Okay. So for the advice for you for cleaning the mouth, your toothbrush and your fluoride-containing toothpaste, and then you should do your dental flossing. The dental flossing will ensure that you're cleaning in between your teeth. Sometimes we advocate mouthwash, and then apart from that, you should ensure that twice a year you visit your dentist. So I'm sure if you do all this, you are sure to have maintain a good oral hygiene. And then he said something about the condition
elderly
where
people,
when
they've lost their teeth.
And
what
you
is
remember that I said that tooth loss is actually
not associated
it's not associated with aging.
Okay.
It's usually due to the accumulative effect of whether it's periodontal disease or maybe neglect, poor oral health that has been neglected for over years, and that could lead to the loss of teeth. When you have chronic periodontitis and you keep losing the teeth, that could result in tooth loss. And in some people, you have that by the time they become old, there's no teeth in the mouth at all. That is what we call the complete edentalism. So you have a patient that is completely dental loss. There's no teeth standing in the mouth.
Thank you very much. Now, I'll ask this very simple question, but it doesn't, I don't think it looks simple. Hard and soft toothbrush, which should be preferred, and what should be the reasons?
We usually advocate medium bristle toothbrush. When you say
when we
hard,
get to the supermarket, we usually say hard and we say soft toothbrushes. Which should be preferred?
They are medium bristle toothbrush. But if there are no medium bristle toothbrush available, you can pick your soft. When you have a choice for hard or soft bristle toothbrush, the soft one is advocated, because the hard bristle toothbrush, what it does is that it causes damages to the teeth in such a way that you have the enamel, which is the first layer of the teeth, being worn off, and then the second layer, which is the dentin, that has the nerve fibers, it's exposed. And these nerve fibers we also have in that dentin a channel, tiny microscopic channels that actually leads to the third part of the tooth, which is the pulp. So when you take cold water and then a hot drink, that leads to sensitivity of the teeth, and that creates a problem. Once your dentin is exposed, dentin is not that's the second layer. It's not as hard as the first layer, which is the enamel, and that causes further tooth wear, and that could lead to the third part of the tooth, which is the flesh part, the pulp. We call it pulp, to being exposed, and that will lead to the tooth being infected. That will also spiral down to the root of the tooth. Invariably, you might end up losing that tooth if intervention is not done immediately.
Talking about this, tooth sensitivity, just like I mentioned a while ago, I do know that there are some form of toothpaste that are usually recommended to take care of that, because oftentimes we hear people complaining that when they take coatings, they get shocking sensation in the mouth. And that feeling, that type of feeling usually comes after taking oranges. What are the correlations?
You know, the orange has an acidic impact, and that will actually affect, it will flow down the what we call dentinal tubules, the channel, and that could actually cause pain. And then most often at times, when you visit your dentist, there are some materials that are placed at that area to block off that tubule, so that you don't have that sensitivity, depending on the severity of what you have.
Okay, what advice do you have for vitamin D supplementation in a bid to guard against osteoporosis, which could come up badly for someone who has oral health challenges?
About vitamin D,
is it advisable for one to be on it to maintain healthy teeth?
I will advise that whatever, you should actually seek your doctor's consent, because I don't believe in doing the over self-medication or over-the-counter habit. So the best thing is for you to see your dentist, and then you will be examined, and the appropriate treatment will be effected.
Now, let me take you on this. Tooth extraction. Sometimes we'll see people, young people that may have gone for tooth extraction 2, 3, 4, 5 times. How advisable it should there be some other remedies other than doing outright tooth extraction for these young individuals? But before that, let's take Amos from Nasarawa. Good morning, Mr. Amos. Hello, are you still there, Mr. Amos?
Yes, good morning.
Yeah, please go ahead.
Okay. Hello, good morning.
Good morning, Mr. Amos. We can hear you.
Yes, I'm really enjoying your program. Well, I have a question.
Thank you very much.
Yeah. Suddenly, I discovered that one of my teeth started growing without any stoppages. I wonder what is the reason.
Started doing what?
And the teeth shoot up.
Okay.
It's growing.
Okay.
At my age, I don't expect my teeth to be growing
It's
that
moving
way.
up.
How
So I
old are
don't
you,
know what
sir?
is the Yes, I'm 40.
Okay.
Does it have space, opposing space around that teeth?
Sorry?
She said, do you have opposing space around?
Is there any spacing?
No, there is no spacing at all.
Any pain? Any other associated symptoms?
No associated pain.
So you just notice that the tooth is moving.
No, it's not shaking per se, but it's growing. It's shooting out.
So you need to visit your dentist.
Okay.
Do you have gum bleeding?
No.
Your
I've
gums
not
are not
bleeding.
inflamed. So you need to visit your dentist. So proper examinations will be done. If it needs for you to have an x-ray done, that will be done. And then the diagnosis will be made and proper treatment will be done. So you need to actually visit your dentist to have a proper examination.
Okay, we have Dan from Delta. Good morning, Mr. Dan.
Yeah, good morning,
Yeah.
Doctor.
Yeah,
Good
nice to
morning.
have you, sir.
All right, it's a pleasure listening to you.
Yeah, thank you.
Okay, I have two questions, please. Can you hear me?
Yes, loud and clear.
Okay, the first one is this dental disease or tooth problem. Is it hereditary? That's the first question.
Okay.
Then the other one, oftentimes I've observed that when there is when people have toothache and then they go to the hospital, from my observation, the recommended option is tooth extraction. You understand me?
Yes,
I
sir.
wouldn't know the extent of the tooth problem, but my wife had an issue some time ago. A tooth was extracted, and then my son also, at a tender age, had a tooth problem. Went to the dentist, and then the tooth was extracted. Well, thank God, then it was still the mixed teeth. So, is there any other remedy outside extraction, maybe treatment, and such a tooth can be retained? Thank you.
Okay. Now, I first want to answer the first question.
Yes.
He said, is it
Tooth problems. Are they hereditary? Yes.
It depends on the kind of tooth problem. So if you're talking about malocclusion can be hereditary. If you're talking about, when you talk about dental caries, you know, I mentioned the other time that it depends on different factors. One of the factors is that the shape of the teeth. Some have the occlusal shape that is deep so that it can retain food when you eat, and that could be hereditary. But most often at times, it's not hereditary. It's due to our habits. It's due to what we do. It's due to how we take care of our mouth. Now, the second question, you said that when you go to the hospital, that most often at times, that the treatment option that is offered is extraction. There are various treatment options that you have. Take, for example, tooth decay. Tooth decay, depending on the stage, that will inform you on what the treatment should be. But I will want to quickly say that in our environment, we don't visit a dentist regularly, or we don't come early enough for the tooth to be safe. Most times is when it's now symptomatic, when there is pain that is disturbing, pain that cannot allow us to sleep, pain that is affecting our work. That is when we decide to visit the dentist. And at that time, the treatment option would either be for you to do what we call a root canal treatment and then have it capped, or some will opt for extraction. And this, you also know, it has financial implication. Now, other treatments that could be done when you come, like you rightly asked the other time, is what we call filling, that could be done. And even before that, when you are coming regularly twice a year, the early stage will be detected, and that could actually not involve any surgical treatment. That maybe we're just putting a preventive measures like applying your fluoride and all that. That will prevent you from losing your teeth. I hope I've been able to answer those questions.
Yes, so perfectly well. Now, Engineer Joseph from Nasarawa. Good morning, sir.
Morning, how are you?
I'm fine, thank you.
Yes.
We can hear you loud and clear. Please go ahead, sir.
Morning, how's your work, sir?
We are doing good. And you?
I really enjoy your program.
Thank you very much, sir. We appreciate you.
Yes. My question goes like this. If one has mouth odor, what does it do? Hello?
Go ahead. If one has mouth odor?
Mouth odor.
Okay. Okay. Does it have to do with oral problems? Is that the question?
Yes.
Okay.
Yes.
Thank you very much, ma'am. Prof, will take your question.
Okay, so mouth odor can be due to oral problem. It can also be due to some other systemic diseases. So when you have upper respiratory tract infection, it could cause mouth odor, or it can be as a resultant of GIT problems. That could also cause mouth odor. But when you talk about oral diseases that can cause mouth odor, when you have poor oral hygiene, gross accumulation of plaque and calculus in the mouth, it could lead to oral or mouth odor. When you have what we call periodontal abscess, you have boil or gum boil in layman's language, that could cause mouth odor. When you have tooth decay or dental caries, so there's a cavity, anytime you eat, food stagnates around there, that could cause mouth odor. So those are the few things that could cause mouth odor in an individual. Sometimes you will have what we call psychogenic halitosis. In that case, the individual feels he has mouth odor, but people around him, they can't seem to perceive that mouth odor. So that could also be as a result of psychological impact.
Prof, back to where we left it.
Yes.
Okay, so I have a question. What is the correlation between a chronic illness like hypertension, arthritis, asthma, with tooth loss?
Okay, so...
But before my question, let's take that off. Stephen. Stephen from Lagos. Stephen, good morning, sir.
Good morning, sir.
How are you today?
Good morning, sir.
Good morning.
Thank you.
Yeah.
Please go ahead.
Okay, thank you, sir. Straight to the question, sir.
Yes.
Sir, my own case, I have extracted 6 teeth.
Wow.
6?
6.
Wow.
Has he replaced it?
So
have you replaced it? And then how old are you?
I haven't replaced it.
How old are you, sir?
Okay, I'm almost 40 now.
Okay. Thank you very much. Go ahead.
So, and I would like, what could have been the cause that resulted to me extracting 6 from it? And secondly, please, quickly, a lot of people want to go for checkup, but they are not financial buoyant, because sometimes, like, extracting a teeth now can take you up to like 15,000 to extract a tooth. So how can people be helped? Because people are scared going to hospital for checkup and all that because of the money they will mention that they should pay. So what can be the solution? How can they be helped? How can government come in here and help the people? That's the second question. Okay. Thank you, sir.
Thank you very much for those key questions of yours.
Yes. I want to ask him a question. Why were the teeth extracted?
Are you still on? I'm sure he doesn't know. He
yes.
Probably
so
he has no idea.
Because one of the questions he asked was that
He has extracted
yeah,
6.
he has extracted 6. And why is he extracting his teeth? So I wanted to find out whether
Does it have
was
to do with
due
his
tooth
diet?
decay. Yeah, that's what I wanted to find out whether
What
it's
is the
due
place
to
of
tooth
chocolate? If it is diet, chocolate, and
yes, all those
Hello?
sugary things and
Yes.
fizzy drinks. You know, I mentioned earlier on that in between snacking.
Stephen, are you still there?
Yes, I'm still on.
Okay. So, Prof has some questions for you.
So those 6 teeth that you extracted, what was the cause? What were you told in the clinic when you went
Okay.
for extraction?
I think my first experience, the doctor was a private hospital. He told the dentist. He told me. He said maybe a lot of sugary things and all that.
That's
Though
due
I
to
ate
tooth decay.
chocolate a lot then and some other sugary things like that,
I hope you have stopped.
I stopped.
Okay, so like he said, most times it's usually due to our habits, and then I'm sure that he has a habit or attitude of waiting till the last resort before going to the see his dentist, because he mentioned in his story that most people would not want to go because it's expensive.
Yes.
So that means that he waits until he has no other option but to go. That could inform us of why he keeps extracting his teeth. So he's not likely to have been keeping to the twice a year visit to the dentist, because those
On account of
initial
financial constraints.
Yes, financial constraints. So we want to appeal to the government to. I know the government hospitals, they could actually subsidize dental treatment for the masses. So that could encourage them to come for dental treatments. But basically, I'm sure the government hospitals, they shouldn't be that expensive, because he said extraction would be like 15,000 now. I'm sure Lagos University Teaching Hospital, you could come in there. You have the general hospitals around you in the neighborhood that you could actually have access to. I'm sure it won't be that expensive.
Thank you very much. So, to my own question, any relationship or correlation between some of the chronic illnesses I mentioned a while ago, hypertension, asthma, arthritis, rheumatoid arthritis precisely, with tooth loss?
So for hypertension, sometimes the blood supply,
Yes.
reduced blood supply could actually lead to you losing your teeth. I know in some cases, some antihypertensive drugs, they have side effects of reduced salivary flow. And when you don't have adequate salivary flow in the mouth, that means you don't have saliva bathing the teeth in the mouth. There could be increased risk of you developing tooth decay. And if this is not attended to, it might lead to the loss of the teeth.
Okay.
And then sometimes when you have tooth loss, basically for the posterior teeth, if it's not replaced, it could actually affect the joint between the upper and the lower jaw, which we call the temporomandibular joint. And that could lead to what we call temporomandibular joint dysfunction syndrome. And part of this dysfunction syndrome, you could also have temporomandibular joint arthritis.
Thank you very much, ma. What's the treatment option for chipped tooth or cracked tooth?
Okay, so if you have fractured teeth or you have chipped tooth, it depends on...
That is not presenting with symptoms.
Yes, it depends on how extensive this fracture is. We could do a simple composite filling or composite just to restore that part that is chipped off.
Okay.
And in some cases, we need to cap the tooth. Okay. We say cap the tooth, we call it a crown. So it looks exactly like your tooth, like you're wearing something on your tooth. So it takes the shape of the tooth and the color of the tooth to restore the tooth back to its shape.
Thank you very much, ma. Thank you so much. I'm afraid this is how much our
You're
time can
welcome.
allow us. The person who has been with us is Associate Professor Dr. Bolanle Oyeyemi Akinbobye from Luth. We appreciate you. Thank you so much for
You're
coming.
welcome.
And of course, tomorrow is World Oral Health Day. I'm sure they will have a lot of programs
Yes, we
lined up for this great day. All the best, ma.
Thank you very much,
We
Doctor.
appreciate you.